Imagine a complex puzzle where each piece is a symptom, a lab result, or an image. Your job is to connect them perfectly to reveal the bigger picture and, ultimately, guide someone back to health. Sounds intriguing, doesn't it? This is the daily reality for doctors in a variety of medical specialties. Many medical fields are intensely focused on patient diagnostics, which is the process of identifying the nature and cause of a patient's illness or condition. These specialties are like the expert detectives of the medical world, using a combination of scientific knowledge, clinical skills, and technology to solve medical mysteries. They are absolutely crucial for ensuring patients receive the correct and most effective treatment. The core mechanism behind diagnostic fields is their commitment to uncovering the underlying etiology of disease, meaning the cause or origin. This involves a systematic approach that typically begins with a thorough patient history and a comprehensive physical examination. From there, doctors often order a battery of specialized tests. For example, internists who practice internal medicine excel at diagnosing complex adult diseases that might affect multiple organ systems. They are skilled at putting together a multifaceted clinical picture. Pathologists, on the other hand, are the backbone of laboratory diagnostics. They examine tissues and body fluids under a microscope, performing detailed analyses that are critical for diagnosing cancers, infectious diseases, and autoimmune disorders. Think of them as the behind-the-scenes scientific experts. Then we have radiologists, who are masters of medical imaging. They interpret X-rays, CT scans, MRI scans, and ultrasounds to visualize internal structures and identify abnormalities that might not be apparent during a physical exam. Neurologists specialize in diagnosing disorders of the brain, spinal cord, and nerves, often relying on detailed neurological exams and specialized tests like electroencephalograms or nerve conduction studies. Each of these fields brings a unique set of tools and expertise to the diagnostic process, working collaboratively to reach an accurate conclusion. The process itself often involves what is called differential diagnosis, where physicians consider a list of possible conditions that could explain a patient's symptoms, and then systematically rule them out until the most likely diagnosis remains. For those of you considering these diagnostic-rich fields, gaining experience is key. During your medical school rotations, pay close attention to how physicians approach challenging cases. Look for opportunities to shadow doctors in internal medicine clinics, pathology labs, or radiology reading rooms. This hands-on exposure will give you a real sense of the intellectual rigor and satisfaction these specialties offer. Ask questions about the diagnostic pathways and the reasoning behind each test ordered. Understanding the practical application of diagnostic principles will solidify your learning. What makes these diagnostic fields truly special is their ability to transform uncertainty into clarity. The ability to accurately diagnose a rare disease or correctly identify the stage of a common one has profound implications for patient care and outcomes. These doctors are not just ordering tests, they are weaving together narratives from fragmented data, making critical decisions that directly influence a patient's future health. They embody the scientific rigor and compassionate detective work at the heart of medicine. Ultimately, careers focused on patient diagnostics offer an incredibly rewarding path for those with a keen eye for detail, a strong analytical mind, and a deep desire to help others by uncovering the truth behind their ailments. These fields are where the power of observation meets advanced science, creating a vital bridge between symptoms and effective treatment. Pursuing a specialty in diagnostics means dedicating yourself to being a frontline solver of medical puzzles, directly impacting patient lives every single day.